Are you holding your newborn and wondering, am I doing this right? You're not alone. Every new parent feels this mix of love, stress, and confusion. Caring for a newborn can feel like a lot at first, but take a deep breath. You're not doing this alone. In this video, I'll guide you through all the basics: feeding, sleeping, bathing, soothing, holding, and keeping your baby safe, step by step, so you feel calm, confident, and ready to care for your little one. Welcome to Parenting Glow Path. Before we begin, don't forget to subscribe to Parenting Glow Path for simple, helpful tips that guide you through every stage of parenting. Section 1. Bonding, Holding, and Skin to Skin. Let's start with the very first thing every new parent wonders: how to hold your newborn safely and comfortably. A newborn's head is heavy compared to the rest of their body, so always support the head and neck. Slide one hand underneath the head and neck, and the other under the bottom. Bring your baby close to your chest and hold them securely but gently. One of the best things you can do, especially in the first hours and days, is skin-to-skin contact. Simply place your baby on your bare chest, cover both of you with a soft blanket, and let them hear your heartbeat. Skin to skin helps with temperature, feeding, bonding, and calming. And it's not just for mothers, partners too should do skin to skin. Your baby knows your voice, your smell, and your warmth. Talk to your baby as you hold them. Your voice is comforting. It's the first sound they knew before entering the world. A simple phrase like "I'm here" or "you're safe" does more for bonding than you can imagine. Section 2. Feeding, breastfeeding, and bottle feeding. Feeding is one of the biggest concerns for first-time parents, and it's completely normal to worry about whether your baby is eating enough. Let's break down both breastfeeding and bottle feeding in the simplest way possible. Breastfeeding. When breastfeeding, your baby's latch is everything. Bring your baby to your breast, not the breast to the baby. Their mouth should open wide. Think of a big yawn. And they should take in not just the nipple, but a good part of the areola. When the latch is good, breastfeeding should feel like a pull, not a pinch. Newborns typically feed 8 to 12 times each day. That can feel like a lot, but newborn stomachs are tiny. Look for early feeding cues: rooting, turning their head, sucking on hands, or becoming fussy. Don't wait for full crying. Crying is a late hunger cue. You'll know your baby is feeding well if you hear soft swallowing, your baby seems relaxed afterward, and wet diapers increase each day. If breastfeeding hurts a lot or you're worried about your supply, you're not failing. You just need support. A lactation consultant can help more than you imagine. Bottle feeding. If you're bottle feeding, hold your baby semi-upright and tilt the bottle just enough so the nipple fills with milk to avoid air. Avoid propping the bottle. Feeding is also bonding time. Use paced feeding. Let your baby suck for a bit, then tilt the bottle down to give them a break. This helps prevent overfeeding and reduces gas. Warm the milk gently and test it on your wrist. It should be warm, not hot. And remember, it's okay if you choose formula. What your baby needs most is a fed, calm parent. Section 3. Burping and spit up. After feeding, most newborns need to be burped. Hold your baby upright against your shoulder, gently support the head, and pat or rub their back. You can also sit them on your lap and support their chin. Don't worry if they don't burp every time. Every baby is different. Spit up is normal. All babies do it. As long as your baby is comfortable gaining weight and not vomiting forcefully after every feed. Spit up is usually just a laundry problem, not a medical one. Section 4. Diapering and umbilical cord care. Diapers will become a big part of your life for a while. Newborns use about 8 to 12 diapers a day. When you change your baby, wipe front to back, especially for girls. Make sure the diaper fits snugly but comfortably. You may notice your baby's umbilical stump. Keep it clean and dry. Fold the diaper down so it doesn't rub. Sponge baths are recommended until the stump falls off. If you see redness spreading, foul smell, or oozing, contact your doctor. Section 5. Bathing and cleaning. Until the cord falls off, your baby only needs sponge baths. Use warm water and gentle baby soap. Start with the face and work your way down. After the cord falls off, you can give short baths 2 to 3 times a week. Newborn skin is very sensitive, so bathing too often can make it dry. For genital care, clean gently. For girls, wipe front to back. For boys, especially if circumcised, follow your pediatrician's advice and keep the area clean. Section 6. Sleep and safe sleep. If there's one thing every new parent wishes for, it's sleep. Newborns sleep a lot, 14 to 17 hours a day, but in short stretches. Don't worry if your baby sleeps in unpredictable patterns. The most important thing is safe sleep. Always place your baby on their back to sleep. Use a firm mattress and keep the crib clear. No pillows, no toys, no blankets. A sleep sack is safer than a loose blanket. Room share with your baby if you can, but avoid bed sharing in the first months. Babies regulate their breathing better when they sleep near you, but in their own safe space. A simple night routine can help. Dim the lights, speak softly, swaddle if you choose to swaddle, feed calmly, burp your baby, and put them down while they're drowsy but awake. Over time, this teaches them that the crib is a safe place to fall asleep. Section 7. Soothing your baby. All babies cry. That's how they communicate. If your baby cries, it doesn't mean you're doing anything wrong. Let's build a soothing toolkit you can use anytime. Try swaddling. It makes babies feel snug and secure. Pair that with gentle swaying or rocking. Shushing near the ear mimics the sounds they heard in the womb. White noise works beautifully for many babies. If your baby is fussy, check for basics: hunger, diaper, temperature, gas, overstimulation. Sometimes a simple change of environment, stepping outside, a stroller walk, or placing your baby in a carrier, can work wonders. Remember, soothing is a skill you and your baby learn together. Give yourself time. Section 8. When to call the doctor. As a new parent, you might worry about every sound, sneeze, or spit up. That's normal. Most newborn behaviors are harmless, but there are a few signs to watch for. Call your doctor if your baby has a fever of 100.4 degrees Fahrenheit, 38 degrees Celsius, or higher, especially under 3 months. Also call if your baby is feeding poorly, having fewer wet diapers, struggling to breathe, has a blue tint around the lips, is unusually sleepy or floppy, or seems in distress. You are never overreacting by seeking help for your newborn. Section 9. Final words of support. You made it through this entire guide, and that says a lot about the kind of parent you already are. Caring, intentional, and willing to learn. Remember, you don't need to be perfect. Your baby doesn't need perfect. They need you. Your voice, your warmth, your love, and your presence. Caring for a newborn is a journey that teaches you patience, softness, and strength. On the tough days, breathe. You're learning together, and you're doing better than you think. If this video helped you feel more prepared and confident, please like this video so more new parents can find it. Subscribe to Parenting Glow Path for more newborn and parenting guidance, and comment below with your biggest newborn question. I'm here to help you every step of the way. You've got this, and your baby is lucky to have you.